Yes. Hi, Congresswoman Rosa DeLauro from the 3rd District of Connecticut. Such an honor to be here today with my House colleagues and Senate colleagues as we join forces together because what we are dealing with and the crux of what we are all about is a Republican health care crisis, which is going to hit American families hard. Just in a few days, October 20th in Connecticut, the notices are going out. Millions of families will understand that their health care covered through the Affordable Care Act. Those exchanges will get a notification of a skyrocketing premium. Some will double, some will triple. That includes 143,000 people in my state of Connecticut, which is why the Democrats are fighting so hard to extend the current expanded premium subsidies before December 15th. Why? Because the first payment is due on December 15th if you want to have health care on January 1st. So the speaker says, let's talk about it in December. Maybe it's all right for him to talk about it in December, but it's not all right for the people of this country to do that. They don't have the benefits that he has. People have to pay those premiums. But it is not just the ACA marketplaces that are getting hit. Republicans have cut Medicaid by nearly $1 trillion, the biggest cut in the program in the history of the program. It is forcing states to take on much higher share of the cost. And you know what? I take all the states. None of them have the money to be able to pick up the slack that's going to be caused by this. And women make up 62% of adult Medicaid enrollees nationwide. 41% of all births are covered by Medicaid. That's less funding to support families, and delivery will mean more dangerous pregnancies and less postpartum care for those who need it most. I met with the disability community in my district. A young woman, Brianna, gave birth at 33 weeks. Baby's premature. So many development issues. She became part of a program funded by Medicaid called Birth to 3. They worked with her. They helped her to allow her to be able to teach her son how to crawl and how to walk and be able to start school. That will no longer be there. Birth to 3 will be gone. And the ability for a family to take care of a disabled child. And Medicaid is about children, about the disabled, about low-income wage earners, and about seniors. Let's not forget it. President Trump's cuts to Medicaid caused major reductions to homes and community-based services, allows individuals who are aging and those who have special needs to receive care at home or in the community and not in an institution. 60% of caregivers are women. The loss of funding for this program will force their families either to seek out more expensive specialized care for their loved ones or simply forego it altogether because they cannot afford it. Think about uncompensated care and when there is no way for a person to be able to have insurance, but they need help, they need treatment, and they go to the emergency room. That is all uncompensated care. You know, the numbers do not lie. It is a Republican health care crisis. The Republican shutdown. It is sowing chaos and uncertainty for families across the country during a cost of living crisis. Biggest issue today in this nation is cost of living. So people are living paycheck to paycheck. They can't afford electricity, housing, groceries, and the biggest driver of those costs are health costs. And this is all the Republicans have done to protect the tax breaks they wanted to give to billionaires. Democrats are ready. Ready, willing, and able to sit at the table, ready to negotiate. Our message is clear. Cancel the cuts, lower the cost. Let's save health care for Americans. Thank you.